Good afternoon, Madam Mayor, members of the council. I'm Captain Paul Pataka with the Reno Fire Department, and I'm here today proposing a new community risk reduction plan that will help reduce injuries and hospital visits related to falls that occur every year by an aging community. Falls are a significant risk in an aging society. Falls are the top cause of accidents in people over the age of 65. And are also the main cause of serious injuries and accidental deaths in older people. Seniors over the age of 65 are more prone to fall-related injuries that involve broken hips or head trauma. Over the last several years, there has been an increase in responding to people who have fallen and need assistance with getting up, or who are injured from the fall and need to go to the hospital. A clinical investigation published in the Journal of American Geriatric Society in July of 2018 studied 37,324 calls for service in a medium-sized community over a 10-year period from January 1, 2007 through December 31, 2016. Out of those calls, 11% of them were fall-related calls for people over the age of 60. In our community, calls for service are split between going to single-family residences, apartments for elderly people who are being cared for, and assisted living facilities. Some of the causes of falls are a decline in physical fitness, impaired vision, side effects of medications, chronic disease, surgical procedures like hip and knee replacements, environmental hazards in the home, and behavioral hazards. Creating a risk reduction program and addressing the issues of fall prevention within the aging community can prevent unnecessary injuries to the people we serve. Some residents in our community have falls simply because they've slipped on the hardwood floors with their slippers while getting up from a chair or bed. Others have tripping hazards like worn carpets and rugs that have the edges turned up, creating a hazard for them to step over. The most dangerous theme among elderly people who fall is that they don't call 911 right away if they are injured due to embarrassment. This can be very detrimental to their outcome. Clutter, rugs that are worn with turned up corners, hardwood or laminate floors in homes, pets, and wet floors are common causes for slips, trips, and falls with people over the age of 65. 67% of falls that don't happen from a height, they happen when the individuals slip or trip. 95% of these end up in hip fractures due to osteoarthritis and could result in longer hospital stays. Every 11 seconds, an older person is receiving treatment for a fall in the emergency room. Over the past 20 years, the population of over 65-year-olds has almost doubled in the Reno-Sparks area. In 2019, the Reno Fire Department went on 5,202 fall victim calls for service. That is about 12% of the calls for the entire year. And this number is only going to increase, creating a burden on the EMS system as well as the older population. The fire department has the unique ability to educate and recommend ways to prevent falls from happening. The potential effects this program could have in the community are less falls occurring, less fatal and non-fatal injuries, as well as less calls of service for the department. Being proactive on the front side will reduce injuries and bad outcomes for an aging community. It is projected that if communities do not do anything about preventing falls, that the rates of death from a fall will be 7 deaths every hour by the year 2030. This program could be adopted by the local healthcare providers to assist in educating the public about the importance of fall prevention in the home. While at a fire and cooking safety event at assisted living facilities, a fall prevention brochure could be handed out and talked about as well. The department could incorporate the Remembering When program developed by the National Fire Protection Association, which is a comprehensive fire and fall prevention program for older adults in the community. The program was designed to be implemented by a coalition comprising the local fire department, service clubs, social and religious organizations, as well as retirement communities. It includes fire and fall prevention flyers, a home safety checklist, safety tip sheets, and information on how to run group presentations and how to conduct a home visit for those who would like one. Line firefighters can be trained to look out for problems in homes they respond to that can cause someone to fall and injure themselves. Older adults are the key stakeholder in preventing falls, but they need the support of their informal caregivers, healthcare providers, and community groups. Together, these stakeholders can assist older adults in self-management of fall prevention based on the preferences of the individual, local resources, and available programs and healthcare services. Some of these programs would allow people to live longer, healthier lives in their own homes, maintain independence, and not need the assistance of others to care for them. Does anyone have any questions about the program? I would like to thank Madam Mayor and the City Council for taking the time to hear about this community risk reduction program about fall prevention within the elderly community.